Essential fatty acids are fatty acids that our body can't produce. They must be obtained from the diet. Two essential fatty acids belong linoleic acid and linolenic acids. Both of them we use to produce biologically active substances which help us regulate various biological pathways in our body. So let's illustrate it. We get essential fatty acids from our diet, mainly from nuts, fish, and vegetable oils. Once linoleic acid and alpha-linolenic acid enter the body, we can use them to make a number of important substances. Linoleic acid gets converted into arachidonic acid, while alpha-linolenic acid is used to make eicosapentaenoic acid and docosahexaenoic acid. Now, arachidonic acid is quite versatile. We use it to make prostaglandin E2, which triggers the inflammatory response when we need it. We also use it to make thromboxane A2, which stimulates platelets aggregation. On top of that, arachidonic acid gives us leukotrienes. These help attract immune cells to where they're needed in a process called chemotaxis. Also, from docosahexaenoic acid, we produce resolvins and protectins, which are specific mediators that provide anti-inflammatory effects. And finally, arachidonic acid is used to build phospholipids for our cell membranes, which is especially important for skin and gut epithelial cells, hair follicles, the myelin sheath around our neurons, and the retina in our eyes. The most common reasons people develop essential fatty acid deficiency are simply not eating enough of the right foods or having a condition that prevents proper absorption, like cystic fibrosis, celiac disease, or chronic pancreatitis. So what actually happens when you don't get enough essential fatty acids? First, because linoleic and linolenic acids are low, the body can't produce arachidonic acid, eicosapentaenoic acid, and docosahexaenoic acid. With less arachidonic acid available, prostaglandin E2 drops, and this slows down wound healing. Thromboxane A2 also decreases, which means it takes longer for bleeding to stop. Lower leukotriene levels weaken the immune response and make it harder for the body to fight off threats. Additionally, decrease in production of resolvins and protectins creates a pro-inflammatory state. On the skin side, you get scaly dermatitis and dryness because the cell membranes just aren't being built properly. Hair growth slows down and the scalp becomes dry and flaky. Neurologically, reduced myelin production impairs nerve function, and without enough docosahexaenoic acid, the retina starts to suffer, leading to vision problems. In children, this can even cause developmental delays. Additionally, because linoleic acid is low, the body starts making more trioleic acid as a poor substitute, which can serve as a biochemical market of essential fatty acids deficiency. In contrast to essential fatty acids, consumption of trans-unsaturated fatty acids, which are found in fast food, greatly increase the risk of cardiovascular disease, primarily through elevation of low-density lipoproteins and lowering of high-density lipoproteins.